Hello everyone, I am Miss Kinnan. I'm going to tell you today about newborn assessment format. The objectives of today's slides is to let you know about the usage of newborn assessment format and to make sure that you have the confidence to use this format when you are assessing a newborn during your maternity nursing clinical practice. So the first thing that you need to write is about the demographic data. So you have to write the patient's identity, what's the name of the baby, what's their sex, gender, date of birth, and the assessment date. Then you have to write the identity of the contact person, the name, the age, the religion, education, occupation, the relationship, address, race, and nationality. This could be the mother that we are assessing and could be also the father of the baby. Next, we write about the birth history. So we write whether this baby has been born through spontaneous or assisted or surgery. How's the placenta, born with what, like it's like complete or incomplete. And then how's the placental condition, how's the Apgar score, what's the gestational age of the baby, is that according to due date or less than due date, is there any resuscitation needed when the baby was born. Next, we move to physical assessment. So we assess the general condition, what's the chief complaint, how's the baby, is that a normal baby with a less than due date, or is that not normal baby with small birth weight or something like that. And then we will write about the general appearance, how the baby's looks like. So over here, then we check the skin and lip color, is it pink, icterish, cyanosis, or pale. We see how the posture and the movement of the baby, is there any obvious totonus or seizure or tremor, it's like a tatonus, tonic motor movement. And then we watch about the consciousness or activity, is that normal, lethargy, weak, less activity, not present. For phrenic sesosa, present or not present. And we also write about the birthmark, whether it's present or not present on the baby. Then we assess the vital signs, breathing, pulse, and axillary temperature of the baby. So we have to write about the breathing pattern, frequency, the rhythms, that apnea, and then the pulse, the frequency, the pulse rhythm, is it any apnea as well. And next we assess about the head. So we write about the head, what's the head circumference, is there any hydrocephalus, anterior fontanelles there, and then cephal hematoma, so is that any hematoma on the head, and then caput-succedaneum is like, is there any swelled of fluid on the head which come from the labor process, and then is there any mollusc or molding that the baby skulls overlapping on each other during the labor process, and how's the problem on face, is there any uncommon conditions on baby face, how's the ear, and how's the eyes, is there any secretion, how's the eyelids, is there any subconjunctival bleeding, and then how's the mouth and nose, do we have how's the mucous membrane, is there any labiacism or palatism, or even there is any truss inside the mouth. So labiacism means that the mouth is being cut in the middle, like in the conditions of palate is not fully developed, and truss when you have like a problem within your mouth. The next one is you check about the neck, is there any enlarged thyroid nodes, and then on the chest you see the chest shape, is there any a problem, and you write about the chest circumference, and then you assess the breathing sound, and you check about the abdomen and the back. How's the condition of the umbilical cord, is there any abdomen distension, is there any present omphalocele, where the babies have abnormal condition on the abdomen, where the organs, it looks like hernia come out from the umbilical, and is there any anus imperforate, so the anus is not perfect. And you have to check the genitalia for male, Is there any two testes inside the scrotum? Is there any hole on the top of the penis? And then for female, is the labia major and labia minor is there, and there is a vagina, a hole for the baby. Next, we check the extremities. We check how many numbers of the fingers and toes. Is that complete or incomplete? Is there any trauma, abnormality? Assess the reflex for sucking, grunting, grasping, moro, gagging, sleeping, walking, startle, Babinski, and tonic neck. This all about the reflexes I've explained in the video about the newborn assessment. And then you check also about the elimination, how's the poop, the color of the poop, the frequency and consistency, how's the pee, the frequency, the color and the volume of pee. If it's like a newborn baby, you will expect that meconium will be there. I also explained this in the previous video. And then next we move to the diagnostic test, the laboratory result. You have to write the date, the name of the test, and then the result of diagnostic test with the normal value inside a table. And then you need to have the APGAR score. You need to see what's the score of this baby for APGAR. Then you put it inside the assessment form as well for the APGAR score. So you have to write what's the first minute and then what's in the 5th minute. So you will have two tables, the table of the diagnostic test, and also the table field of APGAR score. Then the next one is you do the data analysis, that you have a subjective and objective data, etiology and nursing diagnosis. For example, you're going to write about ineffective breastfeeding, so make sure that you write about the pee and the poop in the section, how's the baby having the breastfeeding these days. And you write the etiology, and then you write also the nursing diagnosis. Or you can also write risks for infection or risks for hypothermia according to the baby's condition. The next one, you write the nursing diagnosis in full. So you arrange the PES format, so problem related to and as evidenced by the symptom. So you write it down here, 3 nursing diagnoses related to the baby. So as I mentioned before, you can choose ineffective breastfeeding, hypothermia, and risks for infection, or you can choose any other thing that you want to write on this section as your nursing diagnosis. Next one, you make a nursing care plan. You organize per nursing diagnosis that you have already formulated previously, and then you just do the goals and expected outcome in another column, and then you put the action plan and the rationals. So you have to understand that the plan should include observation, nurse independence action, and collaboration, as well as education action. So then we do the rationale for every plan that we planned. So you can make a table with 3 columns: the goals, expected the goals, expected and the goals and expected outcomes, the intervention, and the rationals. Next, you will have to document all your nursing actions, including observation, nurse-independent action, collaborative action, and education during the patient stay for the case study by the student. So you have to document it here as a progress notes or nursing documentations by student or by the nurse. So you can do both. And after that, you do a nursing evaluation. You use the form of SOAP, which is subjective, objective, assessment, and planning. So you will have there what you want to do with the nursing diagnosis that you have worked on. For example, ineffective breastfeeding. Now the baby start to suck. You can see that the baby burp. You can see that the baby has milk, looks satisfied. And then assessment, you can say ineffective breastfeeding already being fulfilled. And then you can continue with the planning that you have to maintain the breastfeeding. Then you can write the name and initials on there. Then the next one, the one that is very important, is the informed consent from the preceptors, head nurse, and CI that during the time you are taking care of this patient for your case study and application of nursing care, they have been informed. They know, they assist you with it, and they provide consultation. Then you just put their name and put their date and then ask them to sign here. Make sure that you have a very good communications between you, preceptors, head nurse, and CI. So that's the end of my explanation for this form. I hope that you learn.